This is topic 4.20, Science, Medicine, and Technology in Black Communities. We have our first learning objective, which is to describe African Americans' contributions to scientific and technological advancements. African American innovations and scientific discoveries have had a global impact with significant contributions in the fields of agriculture, technology, medicine, science, and engineering. Lewis Latimer helped develop toilet systems for railroad cars and helped create better carbon filaments for light bulbs. Patricia Bath was an ophthalmologist who was the first African American woman to receive a medical patent for her laser device for cataract surgery. George Washington Carver was born enslaved in Boston and became a botanist and professor. He expanded the uses of peanuts and sweet potatoes to the extent that they could be used for body care and more. He invented methods to combat and prevent soil depletion while promoting crop rotation. He served as an agricultural counselor to President Theodore Roosevelt, rising to national honor and national recognition. African American women have made multiple contributions to space exploration, astrophysics, and aeronautics. However, they have not been widely recognized for their contributions and accomplishments. Katherine Johnson was a NASA mathematician for more than 30 years, nicknamed the human computer because of her fast and accurate calculations. She performed vital calculations for the Apollo 11 mission and John Glenn's orbit around Earth. Katherine Johnson faced racial discrimination working at a predominantly white and male facility, as well as an area of study dominated by men. She was working in segregated facilities before they were desegregated, facing first-hand racial discrimination and inequalities in a work environment. However, in 2015, President Barack Obama awarded her the Presidential Medal of Freedom. Mae Jemison is the first African American woman to travel in space, going on the STS mission in 1992. She's an engineer, physician, and astronaut who performed bone cell and microgravity research. She served as a doctor in the Peace Corps in Sierra Leone and Liberia. She later left NASA to advocate and promote minorities and young girls to pursue careers in STEM. She also worked as an entrepreneur, founding the Jemison Group. On the left, we have our first source reader, which is Mae Jemison working at zero gravity in 1992. This time, she was working at NASA, and she made history in the year 1992 as the first African American female to go into space. We can see her environment is focused on engineering, and this relates to her identity as Jemison was an engineer. She's floating because she's working at zero gravity, which is the condition in space. We can also see that she is competent enough of handling conditions in space, contrary to what racial ideologies might have. We can see that she's competent because she seems to be physically fine, and in order to go to space, you need to have a long and exhaustive training process, which Jemison surely went through and successfully graduated. In the context of his photo, space travel was uncalled for a Black woman, especially a woman, as they were deemed not competent enough to handle the conditions of space, as well as having the intellect to be an engineer, physician, and astronaut, just like how Jemison was. But she proved those stereotypes and generalizations wrong, becoming the first African American woman to go to space as an astronaut. Our next source reader is Mary Jackson at Work in 1977. Mary Jackson was a NASA mathematician and engineer, as well as NASA's first Black female engineer. NASA named a headquarters after her, and she received special permission to take college-level classes at her high school after getting special permission to attend those classes with white students. She is working at NASA, which was considered an unconventional workplace as well as environment for her and her race and gender at the time. Female in this type of environment was considered impossible to be perceived at the time, but Jackson defied those stereotypes that Black women were unable to be smart and work at a highly respected facility such as NASA. In 1976, she was named Langley's Volunteer of the Year. She also helped young people with their own creations like wind tunnels, which she was prominently known for. In 1979, she made a dramatic career change and left engineering to go to Langley's Federal Women's Program to be a Langley Federal Women's Program Manager. She trained the next generation of NASA's female mathematicians, engineers, and scientists. Our next learning objective is to describe African Americans' contributions to the medical care, training, and medical advancements. African Americans have contributed in key ways to the American healthcare system. They've provided free community-based healthcare rooted in the past and established healthcare such as the People's Free Medical Clinics by the Black Panthers, the Black Cross nurses in the 1910s, and encouraged early diagnosis of illness. These clinics and community-based healthcare was designated and occurred because of segregated and inadequate healthcare provided to them because of discrimination and their income bracket. African American physicians collaborated with local governments to create America's first non-segregated hospitals in the 19th and 20th century. This allowed for critical training for African American doctors and expanded access to affordable and accessible health care. These hospitals were established during the Black Hospital movement in the 20th century, in the mid-20th century. The healthcare system would be much different than it is today because of African Americans' contributions to advocating for desegregation in hospitals. African Americans established their own medical schools because very few Black students were admitted to white institutions, preventing them from pursuing medical education. Most of these medical institutions and schools were established at historically Black universities such as Meharry College and Howard University. The National Medical Association was also established because Black doctors were barred entry into the American Medical Association, preventing them from becoming doctors. The National Medical Association, supported the training of Black doctors, which was vital to their career. It challenged segregation and allowed a network of Black physicians who advocated for equal and accessible health care. African Americans have long contributed to advancements in healthcare. This means that contributions aren't exactly newfound. They've just been going on for a long time, and African Americans haven't been receiving their due credit. One example is Onesimus, an enslaved man who brought awareness to the colonies about variolation, which is a procedure that involves transferring materials from a smallpox pustule or scab into a scratch or incision on the skin of a healthy person. This would induce a mild infection, which would typically resolve within a few weeks and build immunity. This helped curtail the smallpox epidemic at the time. Daniel Hill Williams established the first Black-owned hospital, which was Providence Hospital in Chicago in 1891. Providence Hospital advanced critical training for Black doctors. Dr. Daniel Hale Williams also performed the first successful heart surgery in 1893. Richard Strew established methods for storing blood, which were crucial for World War II. His innovation allowed for large-scale blood transfusions, separating plasma from blood. Kizzmekia Corbett was central to the development of the Moderna COVID-19 vaccine at the National Institute of Health. Henrietta Lacks is central to American modern medicine, as she was responsible for the creation of HeLa cells, which is the first immortal cell line. She's also an example of medical ethical abuse. If not for Dr. Hale Williams, heart bypass surgery wouldn't exist today. COVID-19 might also be more prevalent if not for Dr. Corbett's mRNA vaccine. This is a picture. The source reader is Henrietta Lacks, The Mother of Modern Medicine by Kadir Nelson, 2017. As mentioned, she was a woman who was poorly treated in healthcare and had her cells unwillingly taken from her without her consent, and were then used in a medicinal breakthrough without credit, as we know, which were used to create the first immortal cell line. Her cells were created and used for cancer biology and are still used today. Descendants of Lacks did not get any reimbursement, money, or credit from the use and exploitation of the HeLa cells. Lacks died without honor from a poor, low-income Black community. Her case, however, increased ethical awareness in medicine significantly. She's called the mother of modern medicine because of her, cell culture is possible, and her cell establishment has led to multiple advancements, such as polio vaccine and cancer developments. The background we can see simply designed with patterns. This may demonstrate her contribution to modern medicine with cells. We see her in a hat, pearls, a red dress, and carrying the Holy Bible. The pearls may speak about metaphorical wealth, and she may be expressed as happy in this image because of her contribution to medicine and how many lives she's saved. Our last learning objective is to describe the multiple compounding forms of discrimination against Black people with disabilities, as well as the governmental response. There were multiple compounding forms of discrimination, one of them being eugenics, which was on the rise in the early 20th century. This practice and belief deemed people inferior by race or ability through one mechanism of forced sterilization. It was popularized by Madison Grant. Eugenics policies affected African Americans with disabilities, worsening their racial problem with now ableism. Eugenics was a violation of rights, included systematic oppression, harassment, and institutionalization. It also was a part of medical abuse and unethical, which was also on the rise in the 1900s. One example is North Carolina eugenics program, which sterilized over 7,600 people, which were disproportionately Black women. Another case was the Central Lunatic Asylum for the Colored Insane in 1869, which was the exploitation of Black people who were institutionalized for mental illness without evidence and subjected to horrific experiments. This was possible because all the staff were white, with all Black patients, since Black doctors were banned at the time. One of the most prominent examples is the Tuskegee syphilis experiment from 1932 to 1972, where over 600 Black men were left untreated for syphilis without consent to study the disease's effects, even after penicillin became the accurate treatment. This led to the establishment of federal protections of research participants through the National Research Act of 1974. In 1990, the Americans with Disabilities Act was established, built on civil rights legislative achievements. It was influenced by the Rehabilitation Act of 1973. It prohibited discrimination for those with disabilities in areas such as housing, employment, and government programs. Workplace accommodations were required, equal access to opportunities and institutions and public accommodations were also now required. The governmental response to racial discrimination for those with disabilities was inadequate and still is. Another compounding form of discrimination would be finances, as that would be barriers for low-income communities since they might not be able to afford mechanisms like wheelchair ramps. And that's it.